The importance of an adequate breastfeeding in infants is increasingly well known, as well as its impact on health through life. Uninterrupted skin-to-skin contact, at least during the first hour of life, and spontaneous breastfeeding are essential for the establishment of an adequate breastfeeding, which will improve the probability of being exclusively and prolonged. Caesarean section traditionally implies greater difficulty to start the breastfeeding. In our country, it's really common the separation of the mother and the newborn at birth, which routinely goes to the nursery where they give him the first food with formulas that will influence not only the baby latch to the breast and the subsequent feeding, but also in the intestinal bacterial colonization and the development of an immune system of the baby with possible epigenetic effects and predisposing it to different diseases. Letting labor to begin on its own without routinely argumentation and excessive interventions can be a very important measure to reduce the rate of cesarean sections in a society that seems to indicate them in excess. A free evaluation of labor can reduce the risks involved in an elective cesarean section that leaves the baby without the possibility of experiencing the physiological changes related to the birth hormones. The use of non-pharmacological methods in all women in labor to help them cope with the pain of the contractions are very important. There are many ways to give comfort to the future mother, such as physical and emotional support, free movement, trying different positions, massage, hot water, compressions in specific points, and aromatherapy, among others. The humanized cesarean section, focused on the woman, is performed considering not only the physical and physiological needs, but also the emotional ones. This practice gives the opportunity to perform procedures such as a delayed cord clumping and the skin-to-skin contact during the first hour that has been demonstrated as procedures with a lot of benefits for both mother and baby. During a humanized cesarean section, the mother is always accompanied and the emotional support is maintained during the whole process. This procedure is performed in a warm operating theater with room temperature not lower than 26 degrees centigrade, quiet, with dim light and soft music. The whole medical staff is centered in the woman's needs to reduce her stress levels and provide her confidence and make her feel empowered. The regional anesthetic is performed in the minimum necessary medication that allows the woman to be pain-free but fully conscious to see the baby's birth and to take care of him if she wishes, and this in good conditions during the rest of the surgery. Most women want to be involved and see the birth of their baby, which is achieved by using transparent surgical files or, in our case, lowering them so the mother can have a look at it. The extraction of the baby must be gentle so it can allow the self-resuscitation if needed, and a progressive transition to the air. There is no need to make the baby cry intentionally, and the knob is not used to aspirate secretions routinely. Facial expressions, muscle tone, and extremity movements allow the pediatrician to evaluate the baby's condition. The pulse rate can be known by feeling the umbilical cord, which will be clamped when it stops spinning on its own after several minutes. In order to avoid delaying the skin-to-skin contact of mother and baby, it is common to put the baby into the breast before actually cutting the umbilical cord when it is still intact and pulled stale. The pediatrician receives the baby from the obstetrician and places it on the mother with her little head on her side. A sterile technique should be maintained during this transfer and also avoid contact of the newborn with maternal isotin when other antiseptics such as chlorhexidine were not available for cleaning the skin. To achieve the above, it's necessary to fold the surgical files, which will allow to maintain the whole area sterile. With the files below and the mother in slight flexion, the couple will be able to see for the first time the expressions and movements of their baby at birth and receive it on the mother's chest while the umbilical cord remains intact of the surgical files folded and connected to the placenta that is still inside the mother. After the umbilical cord is clamped, the surgical files are raised again, leaving the folded area potentially contaminated now on the maternal side. While the new family stays together in that small and private space that provides them the raised curtain, the skin-to-skin contact helps to maintain the normal body temperature of the baby, and these early uninterrupted interactions with the mother will strengthen the affective bond as well as other physiological and social benefits. Already in the breast of his mother and being skin to skin with her, the newborn is still valued by the pediatrician, who after at least 20 minutes moves him to a thermal cradle next to the mother to go ahead with the identification process, basic care of newborn, and phytometry, always avoiding procedures as aspirating the baby with a knob and the use of probes by the nose and the mouth. The baby returns to his mother's chest in a very short time, or with his father if the conditions of the mother does not allow him to be with her, but always in direct skin-to-skin contact. The baby who stays with his mother in skin-to-skin contact during the cesarean section will develop his sense of smell in a series of primitive reflexes directly related to an early, exclusive, and prolonged breastfeeding. The mother and newborns that remains united develop a special early bond and also are much more likely to initiate breastfeeding within the first hour of life, facilitated by the hormones released during the labor and uninterrupted skin-to-skin contact, and allowing the first spontaneous grasp of the baby to the breast while the mother is still in postoperative recovery, where the support of the nurses is an extremely valuable work and without which this process would not be possible. Afterwards, the new family goes to their final room, where breastfeeding on demand will be crucial for the success of long-term breastfeeding.